Okay, so on the agenda for today are a few items. We'll start off by introducing effortless data collection and MIPS compliance, MIPS quality performance measurement, MIPS CPIA measurements, how you can get 100% of MIPS compliance, the benefits of effortless data reporting and MIPS compliance, and then address any questions that may arise. So we'll start off by introducing the effortless data reporting and MIPS compliance. So what exactly do we mean by effortless data reporting and MIPS compliance? We're moving from an era where medical data from patients were entered via paper and documented, and now we're in an area where we're moving this towards technology. And we're actually eliminating the need for the staff involvement and data collection, and you can report to CMS through electronic means using the patient as the source, which really frees up staff time to do other things. In transitioning from fee-for-service to value-based care, it's revealing new patient-centric opportunities. And a couple of examples of this are by reporting strategically curated outcome measurements through a QCDR. This creates additional MIPS compliance efficiencies. By picking measures that apply in more than one areas, you can report less measures overall and still achieve the highest outcome benefit. Shifting outcome measurement compliance from staff to patients frees up valuable staff resources, and we touched upon this in the previous slide, where you're getting the information from the patient themselves, freeing up the staff to do other practice management or use their time more meaningfully. Energizing patient-physician engagement through patient-reported outcome measurements. And what we mean by this is really providing the tools that are necessary to facilitate that patient and physician interaction. And this is all done through patient-reported outcomes that are coming directly from the patient themselves, and really gives you the tools that you need to track this over time and follow outcomes and improve on those outcomes. So the Medicare Access and CHIP Reauthorization Act of 2015 essentially created the Quality Payment Program, which gives two payment options. One is MIPS, it's the Merit-Based Incentive Payment System, and the second is the Advanced Alternative Payment Models. So we're going to focus a little bit on MIPS now. So for MIPS in Performance Year 1, which is 2017, the way that it weighs itself out is 60% is allocated to quality, 15% is clinical practice improvement activities, and the remaining 25% is the advancing care information. This all gets compiled together, and that gives you your composite performance score, which is on a scale of 0 to 100. And the weight will shift over the next 3 years. They will be introducing, CMS that is, will be introducing resource use into this equation as well, which will balance itself off with the quality within the next 3 years to being 30% each. The scope of today's webinar is to really focus on quality and clinical improvement activities. So MIPS quality performance measures is the second component of our presentation. So the quality performance requirements, as we said, is 60% overall, and the requirement is that you report 6 measures. One must be an outcome measure. However, we would like to focus on the fact that there are process measures and there are also outcome measures. Outcome measures are clinical, they can be patient satisfaction based, patient experience, patient quality of life based, and you're not limited to 5 process outcomes and 1 outcome, or just 5 process measures and 1 outcome. You can pick 6 outcome measures if you want, which will help you get a higher overall CPS score. And OBERD specializes in these outcome-based measures, and we can help you achieve that. So this is an example of the process that we went through in choosing the measures that we recommend. And OBERD has been going through this process for about 4 years now and has really become an expert in this area. What we've done is looked at the different measurement types, as I mentioned before, the process and outcomes ones. We also looked at whether or not this is a high priority measure versus those that are a little bit of a lower yield, which will give you a little bit of a lower score. We've also looked at the data submission methods. How exactly would you be getting this information over to CMS? In addition to this, we've also done a comprehensive analysis of all outcome measures from key players such as MAPI, Oxford, ICHOM, PROMIS, and EQ5D. And for example, let's pull out Oxford. What they do is they have a growing portfolio of patient-reported outcomes that are developed in their public health department, and they're expert in patient-reported outcome measurement development. PROMIS is focusing on person-centered patient outcome measures. They evaluate and monitor physical, mental, and social health in adults and children with chronic conditions. So for the quality performance, the effective delivery of patient-reported outcome measures can be accomplished a number of ways. One, we can eliminate the redundancy of questions by the use of PROM superforms. And what we mean by this is selecting questions that can be presented in one questionnaire that will meet a number of different measures at the same time. There's also web-based and electronically delivered forms which can be sent to the patient directly, thereby reducing the staff time needed to collect this information. EMR independent outcome forms allow for collecting patient data that doesn't necessarily reside in the EMR system or is housed there. Perceptually reduced user experience form designs offers high compliance. And what this is taking a number of questions and presenting them in a way where the patient feels like they're not filling out an arduous amount of questions in a really long form. It's just the way that it's shown to them in a user-friendly manner that makes the process a lot easier and the questionnaire gets completed a lot faster. So the third component is MIPS CPIA measurements. Now, as we said, this is 15% of your composite performance score. There are 8 categories of activities that fall within the CPIA category, and they're as listed here. For example, we can pull out one of them just to give you an example of it, but on the next slide, what we'll do is actually focus on 3 of them. So there are 92 total activities that are in this category, 13 of which are specific to QCDRs. And the strategic use of a QCDR can really help you monopolize on what you're already reporting in the quality area of MIPS. So the 3 categories that we've pulled out is the population management, achieving health equity, and the beneficiary engagement. So achieving health equity, one of the ways that you can do this is pretty much what we're talking about throughout this presentation is the use of patient-reported outcome measurement tools. It is crucial that providers understand the efficiencies that are embedded within MIPS and MACRA and take advantage of those efficiencies while you can. Through the strategic use of a qualified clinical data registry to report quality measures, providers can really achieve 75% of MIPS compliance with 0 staff resources. And that's pretty much by choosing measures in the quality category that overlap with the CPIA category that are EHR independent. How do you get to 100% MIPS compliance? Now, the remaining part is the 25%, which is focusing in the advancing care information category. And for completion, we're including this in this presentation. So if you're using the 2014 version of an EHR, the 4 base score requirements are a security risk analysis, e-prescribing, health information exchange, and providing patient access. This is all captured in the EMR system. And we can obtain this information as a QCDR from you either by a CCD or have you attest for the category. And what we can do is then offer you a 5% bonus available for reporting specialized registries through us. There's also a 10% bonus that is available for using one or picking one of 18 CEHRT improvement activities that we can help with as well. What I would like to point out here is that this particular category is EMR dependent, and we would need either a report that's generated from your EMR system or a CCD file if we're reporting this on your behalf. The benefits of effortless data reporting and MIPS compliance. After setup, there's zero staff involvement that's needed for data collection and reporting to CMS. Patient-reported information provides a powerful tool for physician-patient collaboration. And we use research-validated collection forms that really help you gain meaningful data in a way that doesn't require much effort from your part. We're pretty much giving the patient the control in this case, where they provide the information that you need from them. So all of this helps you to meet 75% of your composite performance score performance. And then to meet the 100% is when you would have to do the additional steps needed by engaging your EMR system for to get 100% of your performance score. Now, collecting data within a patient-centric tool is designed to enable real-time quality performance monitoring. What you do is gather the data, we help you to analyze that information and recalibrate throughout the year. So you really take a step back, look at what you've accomplished, try to figure out what your next goal should be, and how you need to change what you're currently doing to accomplish that goal. And this real-time monitoring powers the ability to identify and optimize the quality performance score by going through this process in a real-time basis that allows you to really measure the things that are more meaningful to your practice. Leveraging human-computer interface design principles drive high compliance form completion rates. And what this means is by making a user face that's easy to use, that's patient-friendly, that doesn't look busy to the eyes and really allows the patient to look at one question at a time and pick an answer and move on to the next question in a way that's not overwhelming to them, really helps with compliance rates. The analytics dashboard to benchmark against millions of other collected forms is something that's also offered in the sense that the information you collect gets benchmarked against all of the other information within the entire system that we offer. A single data source to report collected data to CMS, AJR, AAOS, and any other registry or organization is something that you can accomplish through the setup that we have. We can outsource CMS audit management, reducing the need for staff resources. So now let's put everything that we've talked about together. So we talked about the quality component and the fact that you need 6 measures, which can all be outcome measures if you choose. And then we talked about the CPIA, which is the additional 15%, and we picked 3 categories where you can really maximize your score here. And so what we're doing is using the quality components that you've already picked to help you not do anything extra, but continue collecting those quality things and automatically gain 75% of your total score. And then we talked about the advancing care information category, which could be accomplished either through attestation or sending us the required information that you need from your EMR system.